In this video, we will talk about uterine fibroids. Let's learn together more about them with Dr. Novice Medic. What are fibroids? Uterine fibroids, also known as leiomyomas, are benign, non-cancerous growths of the uterine smooth muscles. What is the prevalence of fibroids in women? It is an estrogen-dependent tumor. It is more common in women during their reproductive years. It occurs in nulliparous women, a woman who has not given birth previously. Obese women. It affects up to 70 to 80% of women by the age of 50. Types of fibroids, depending upon their location in the uterus. There are 4 types of fibroids. Submucosal fibroids develop in the inner lining of the uterus and protrude into the uterine cavity. Intramural fibroids grow within the muscular wall of the uterus. Subserosal fibroids extend outside the uterus, growing on the outer uterine wall. Pedunculated fibroids attached to the uterine wall by a thin stalk. Symptoms: mostly they are asymptomatic, but in severe cases, following complaints occur in such patients: menstrual changes, heavy or prolonged menstrual periods, bleeding between periods, pain, pelvic pain, lower back pain, pain during intercourse. Pressure symptoms: frequent urination, difficulty emptying the bladder, constipation, bloating. Reproductive issues: infertility, recurrent pregnancy loss, complications during pregnancy and labor. How will we diagnose them? Following tests are done to detect the fibroids. CBC. It shows anemia, due to heavy menstrual bleeding, due to fibroids. Pelvic examination, physical exam to feel for irregularities in the shape of the uterus. Ultrasound, imaging test to confirm the presence of fibroids and determine their size and location. Uses transabdominal ultrasound and transvaginal ultrasound. MRI provides detailed images to help plan treatment, especially before surgery. Important to remember before treatment: fibroids should not be treated unless they are symptomatic, like they are causing heavy menstrual bleeding, pressure symptoms, or infertility, or any other painful symptom. Otherwise, let them be. They will regress when a woman reaches menopause, because estrogen supply will be lost. Treatment options. Following are the treatment options for fibroids. Number 1. Medication. Hormonal therapies. Gonadotropin-releasing hormone agonists create a menopausal state that decreases the size of fibroids. Selective progesterone receptor modulators, like hulipristal acetate, is also as effective as above in controlling the fibroids. Both of these are not permanent treatments, as the size of fibroids regrows to original once the ovarian function returns again. Non-hormonal medications. Non-steroidal anti-inflammatory drugs for pain relief. Minimally invasive procedures. These are: uterine artery embolization, blocks blood flow to fibroids, causing them to shrink. More research is needed on the question of fertility after this procedure. Hysteroscopic myomectomy treats only submucous fibroids. It is effective in improving fertility. If it was due to fibroids, relieves heavy bleeding complaints caused by this type of fibroid. Laparoscopic myomectomy removes fibroids while preserving the uterus, using small incisions and advanced surgical tools. Traditional surgical procedures. These involve: abdominal myomectomy, removes fibroids through a larger abdominal incision. Laparotomy incision. Hysterectomy, complete removal of the uterus, the only permanent solution for fibroids. It is indicated in women with no future fertility desires. From this lecture, we can conclude that understanding the types, symptoms, and treatment options helps in making informed decisions about management of fibroids.